Well, health is the base, really, of, in my opinion, of your quality of life. When you're healthy and choose to take care of your body, mind, spirit, soul, all of those things help you to be able to help others. We're all called to serve in one way or another, and when you pay attention to your health and understand the importance of it, that you can't help another unless you help yourself first. I mean, health is at the center of every activity that we participate in.
Before we moved into this building, I.H.S., we were in just a tiny, very tiny building.
And I believe they only had like maybe a double wide or something like that, a single wide trailer that they treated.
You know, the services that were provided then were fairly basic, you know.
And the tiny building actually took care of both people in Kamiah, Orofino, and here in Lapwai. And that's a large population for just one small clinic.
We would go by contract health to Dr. Brian in Kamiah so that we didn't have to travel down here.
We saw our providers for just, everyday illnesses.
The services were contracted through the Nez Perce Tribe through Public Law 638, which is a process by which a tribe can administer funds that are granted by the feds or by the United States government.
We still have significant funding from the Indian Health Service, but we operate independently, which is a tremendous distinction.
This brand new facility actually houses everything that is needed for our people.
Because we have more influence over how that funding is administered, we have a clinic here in Lapwai, and we also have one in Kamiah.
In Kamiah, it is about access. We live very far from any hospital or specialty care. We serve here at Kamiah close to 1,000 patients.
Nimiipuu Health offers comprehensive primary health care all under one roof.
We can really do a patient-focused care, not just medical.
Let's say we take your blood pressure and it's through the roof, and we can have you downstairs seeing a medical professional in 30 seconds.
We have a behavioral health,
pharmacy,
eye care,
our dental, community health, and it's all housed into one building.
The service that our people get is so personal.
Patients can expect quality health care in a culturally sensitive and confidential setting. That is our mission statement.
You can go through the halls and you see stuff labeled in Nez Perce language. If not people you see like your own family members that are working there. Like I said, my sister and my mom both work there.
I believe in a principle called the principle of subsidiarity, where things are managed and ran at the lowest possible level, and who knows better our care needs than us.
The practices that we have, we've lost some of it, but I think what we have, we need to keep.
One of the things that we need to do is be mindful of our history and our roots.
And I really think that if we would go back to our traditional foods, because so many of them have the nutritional value. As you probably have heard, we have a high incidence of diabetes.
Genetically, our people haven't changed in 160 years that we become predisposed. If we changed up what we ate, how much we ate, and when we ate, like our ancestors, I think our diabetes would be more controlled.
And so the traditional methods of what you would be eating and your diet then would probably change a lot of the things that we face today.
Plus, it would get people to go out, to be active, to gather all these things.
Going chemist digging, it's not only fun, it's social.
If you can weave the two together to have the best of our culture and the best of medicine from around the world, I think that's very important.
A long time ago, when Indian Health Service was here, I know a lot of Nez Perce's didn't like Indian Health Service because they felt that they were being practiced on. They would come and do their practice for 2 years and then they were gone.
I don't blame them because that's all they have seen. But with Dr. Hartwig as a medical director position, she has a long-term goal for her family in this clinic.
It's just so wonderful to have her expertise and to have her here with us.
Dr. Hartwig grew up in Lapwai. I mean, she went to school here, and she was a great basketball player, and everybody just loved her.
Sometimes it takes a person from your own family or from your tribe to inspire you or for you to believe what they're saying is truly what you need to do. It's great for the community, great for the facility, great for the future of the Nez Perce.
Oh, it's a privilege. It's a privilege. Medicine in general is a privilege, but it's more of a privilege to help